The pericardium is a tough double-layered membrane which surrounds the heart. Besides protecting and isolating it from neighboring structures, the pericardium, comparable to a wall, ensures that the heart is able to beat within a clearly demarcated boundary, within the confines of which the heart functions as well as maintains. The pericardium is made of two parts, outer fibrous and inner serous. The heart is a three-sided pyramid seated on top of the diaphragm. It has an anterior surface, a base, an apex, an inferior surface, and the right and left pulmonary surfaces. The sternocostal surface is best depicted on the front of the chest wall, behind and on either sides of the sternum. The lower left corner is the apex of the heart. It is mainly formed by the right and left ventricles. The upper right end has both the atria. The aorta and the pulmonary artery emerge in front of the atria and are in continuity respectively.
The human heart is made of 4 chambers, 2 atria and 2 ventricles, partitioned by interatrial and interventricular septa. The right and left atria are the receiving chambers for blood and are located above and to the right of the corresponding ventricles. The ventricles are the ejection chambers and pump blood into the systemic and pulmonary circulation.
The human heart has 4 major valves and 2 minor valves across the bloodstream, circulating through its chambers and major vessels. These valves serve 2 purposes. 1. Maintain a unidirectional blood flow. 2. Prevent backflow of blood. The heart is a muscular pump which contracts to push blood forcefully into the systemic and pulmonary circulation. However, the heart also needs blood for its own metabolic needs, as the muscle is actively contracting all the time. The coronary circulation takes care of the arterial supply and venous drainage of the heart. The right and left coronary arteries cover the arterial supply of the entire heart. The heart also has its own blood supply and venous drainage. Nearly 2/3 of the blood is drained by the coronary sinus and its tributaries. The coronary sinus is located in the posterior segment of the atrioventricular groove at the junction of the diaphragmatic surface and the base of the heart. It drains into the right atrium. Tributaries join it along its course. The remaining portion of the venous drainage is done by a system of short veins called the venae cordis minimae. These empty directly into the chambers of the heart.
The heart is basically a muscular pump made of cardiac myocytes. These cells are specialized for rhythmic contraction, and they do so beginning from the first heartbeat within the womb of the mother until death. Although the atria and ventricles can have their own rhythms, the presence of a conducting system ensures an organized and synchronized contraction, with a time delay between atrial and ventricular systole.